The CDC says nearly 1 in 4 American adults are now fully vaccinated. An average of 3 million doses are being administered daily. But despite that good news, everything else seems to be trending in the wrong direction. The more transmissible and deadlier UK variant is now the dominant strain in the United States. And across the country, new infections and hospitalizations are climbing, particularly among younger people. The latest epicenter is Michigan, where FEMA is sending its own teams to help hurry up vaccinations as new cases and hospitalizations have more than doubled over the last 2 weeks. With me now is Dr. Ashish Jha. He's the Dean of Brown University's School of Public Health. Dr. Jha, always good to see you. I think there's people out there who might say younger people do better with this. So maybe the spike in infections is not quite as big of a deal as some of our public health experts might suggest.
Yeah, so Katie, thanks for having me on. So first and foremost, absolutely true that it is really good stuff that we've vaccinated so many elderly people that we're not seeing a massive surge in hospitalizations and deaths from older Americans. I think that is, we should absolutely take that as terrific progress. The problem here is that there are still a lot of young people who are vulnerable. A lot of them are getting infected, and a good chunk of them are getting hospitalized, and some of them are starting to die, which I think is tragic, especially since we're so close to being able to vaccinate all adults in the United States. And therefore, this surge of infections and hospitalizations in young people, I don't think should be taken lightly.
About a week and a half away from April 19th, when everybody over 16 should be eligible to get a vaccine. Let's talk about Michigan. FEMA is sending its teams to help speed up vaccinations there, but the federal government not sending more vaccine supply as of now. What do you think of that?
I think they should. Look, here's what's going on across the country. There are probably about a half a dozen states where we have seen vaccinations really starting to slow, and the gap between how many vaccines they're getting and how many they're administering is widening, meaning more vaccines are starting to sit on shelves. States like Georgia and Alabama and Arkansas. My take right now is Michigan needs more vaccines. And I love the move by FEMA. I think that's really good. I want the federal government to substantially ramp up vaccine distribution to Michigan. We should get those into people's arms. It's going to make a difference. We've got to be able to do this when there are surges to try to help states out.
There's still quite a bit of hesitancy out there, particularly among Republican men, to get the vaccine. How do you convince people who don't want it, don't trust it, don't think they need it, to get the vaccine? And I'm not saying you, Dr. Jha, because I don't think they're listening to public health experts, but if you're talking to a family member that is talking to somebody in their family who doesn't want to get it, or a local doctor who's talking to their local patients, what do you suggest?
Yeah, so at the end of the day, this is going to be about trusted voices. This is going to be about people who are trusted by the folks you're trying to influence. And so if you're talking about, let's say, evangelicals, where you see a lot of hesitation, it's going to be evangelical leaders that are going to be really important to that messaging. If you think about Republican men, it's going to be Republican leaders like Donald Trump, who I think has a lot of sway and influence. I keep hoping that one of these days he will cut a commercial himself, just talking about the importance of these vaccines, since his administration oversaw so much of the production of these vaccines. But it's really about engaging with trusted voices and having them speak up about this. Obviously, we all need to continue to add our voices to that, but it's going to take all of us to push this forward, not a small number only.
We can't get to herd immunity unless the vast majority of us get this vaccine. Dr. Ashish Jha, thank you so much for joining us as always.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.